Enterobacteriaceae. The members of the family Enterobacteriaceae are aerobic and facultative anaerobic gram-negative enteric bacilli. They are motile by peritracheous flagella or non-motile. They grow readily on ordinary medium, ferments glucose with the production of acid or acid and gases, reduces nitrate to nitrate, oxidase negative except Plesiomonas species and catalase positive except Shigella dysentery type 1, which is catalase negative. They are non-capsulated and non-sporing. Their natural habitat is usually intestinal tract and of man and animal. S.H. coli. Morphology. E. coli is a gram-negative bacilli measuring 1 to 3 micrometer into 0.4 into 0.7 micrometer. The most strain or motile by peritracheous flagella. It is non-sporing and non-capsulated culture. It is an aerobe and facultative anaerobe and grow on ordinary medium at optimum temperature in 18 to 24 hours. On Macankey medium, the colonies are pink due to the lactose fermentation. The lactose fermentation or lactose fermenting colony. The colonies are circular, moist, smooth with enteric margin and non-mucoid. The liquid medium occurs as uniform turbidity, biochemical test, glucose and acid and gas indole positive, lactose positive, urease negative, mannitol positive, citrate negative, sucrose negative, MR positive, VP negative. Antigenic structure. Somatic antigen O. These are heat stable lipopolysaccharide antigen of cell wall and 173 O antigen and have been described, which are designated as 1, 2, 3, 4 and so on. Capsular antigen K antigen. It is a polysaccharide capsular surface antigen. 103 K antigen of E. coli has been described. A flagellar antigen H antigen. These are thermolabile and 75 H antigens have been described. Fimbriae antigen F antigen. Antigenic typing. On the basis of O antigen, E. coli has been subdivided into a number of 0 groups of O groups. Each O group is then divided into subgroups on the basis of K antigen. Each of these subgroup includes strains with different H antigen. The antigenic pattern of a strain is recorded as a number of particular antigen it carries, as for example 0111 is to 550, K58 is to H12. Toxins. Some strains of E. coli produces enterotoxins, hemolysins and virocytotoxins. Enterotoxins. The enterotoxin strains of E. coli produces one or both of the two enterotoxin, a heat labile toxin and a heat stable toxin. The production of both labile and stable toxin is plasmid mediated. Heat labile toxin. It is heat labile protein and closely resembles enterotoxin produced by Vibrio cholera. The labile toxin is composed of one enzymatically active polypeptide A for active subunit and 5 identical B for binding subunit. The B subunit bind to the GM1 ganglioside receptor at the brush border of epithelial cells of same intestine and facilitates the entry of subunit A. The subunit A is activated to yield two fragments A1 and A2. The A1 fragments activates adenyl cyclase in erythrocyte. The activation of adenyl cyclase converts adenosine triphosphate to cyclic adenosine 5' monophosphate. The marked increase of cyclic adenosine monophosphate results in intense and prolonged hypersecretion of water and chlorides and inhibits the reabsorption of sodium. The intestinal lumen is distended with fluid and hypermotility leads to profuse watery diarrhea. Heat stable toxin. In contrast to labile and stable toxin is a low molecular weight polypeptide and poorly immunogenic. The two types of stable toxins are known: the stable toxin 1 and the stable toxin 2. The stable toxin 1 stimulates fluid secretion in the gut through the mediation of cyclic guanosine monophosphate. The mode of action of stable toxin 2 is not known. Hemolysin. Some strains of E. coli produces a hemolysin which can lyse erythrocyte of some species. Virocytotoxin. It is also called as a Shiga-like toxin. Biological, physical and antigenic properties of virotoxin are similar to Shiga toxin produced by the Shigella dysentery type 1. It is of two types, virotoxin 1 and virotoxin 2. They are cytotoxic to viro and helo cells. Disease: urinary tract infection, diarrhea, pyogenic infections, septicemia. Urinary tract infection: E. coli is commonest organism responsible for urinary tract infection. The E. coli that causes urinary tract infection often originate in the intestine of the patient. The route of infection to reach urinary tract is either the ascending route or hematogenous route. The ascending route is through a facial flora spreading to the perineum, and from these they ascend into the bladder. Diarrhea: E. coli causes a diarrheal disease and are of 5 types. They produce diarrhea with a different pathogenic mechanism. Enteropathogenic E. coli, they causes enteritis in infant, especially in tropical countries. The enteropathogenic E. coli adheres tightly to the enterocyte, leading to inflammatory reactions and epithelial degenerative changes. The common serogroup of enteropathogenic E. coli are 026, 055, 086, 0111, 0114, 0119, 0125, 0126, 0127, 0128, and 0142. Enterotoxigenic E. coli. These are the strains that forms a heat-labile enterotoxins or a heat-stable enterotoxin, or both. They are now known to be a major causes of diarrhea in children in developing countries and are the most important causes of travelers diarrhea. The name travelers diarrhea refers to the diarrhea in person from developed countries within a few days of their visit to one of the developing countries. The enterotoxic E. coli also possesses a colonization factor which promotes the virulence by adhering the organism to the epithelium of the small intestine. This colonization factor may be pile or special type of protein K antigen. The most strains of enterotoxigenic E. coli belong to the serotype 60608, 0150, 25, 027, 063, 078, 0148, 0153, 0159, and 0167. The identification of enterotoxin E. coli strain only depends on the demonstration of toxin. The method available for the detection of toxin are listed in table. Beacon test. It is a precipitation test to detect the labile toxin directly on the bacterial colony. The bacteria are grown on a special agar medium containing rapid antibody specific to labile toxin. As bacteria grow and secrete labile toxin, this toxin binds to the anti-labile toxin antibody to form a precipitate line. Entero-invasive E. coli. Some strains of E. coli invades the intestinal epithelial cells, as do dysentery bacilli, and produces disease identical to Shigella dysentery. These have been named entero-invasive E. coli. They belong to the serogroup 0 to 28, 112, 0124, 0136, 0143, 0144, 0152, 0164. On installation into the eye of guinea pig, the entero-invasive E. coli causes keratoconjunctivitis. This diagnostic test for entero-invasive E. coli is called as a Serini test. Another diagnostic test is invasive of HeLa or HEP2 cells in tissue culture. Enterohemorrhagic E. coli or virocytotoxin producing E. coli. This strain causes hemorrhagic colitis and hemolytic uremic syndrome. It is most common in infants and young children, but can occur in all ages. Toxin responsible is called virotoxin because of its effect on viro cells in culture. These strains belongs to the serogroup 0157, entero-aggressive E. coli. These strains are so named because they appears aggregated in stocked brick for formation on HEP2 cells or glass. They forms a heat stable enterotoxin called as a entero-aggregative heat stable enterotoxin 1. Pyogenic infections, wound infections, peritonitis, cholecystitis, neonatal meningitis, septicemia. This condition usually occurs in debilitated patients and mortality is very high. Laboratory diagnosis: the urinary tract infections. Normal urine is sterile, but during the voiding may becomes contaminated with the commensals of genital tract. Specimen collection: midstream urine specimen. It is collected prior to the administration of antibiotic. Specimen is collected in a sterile container. Catheter specimen. The urine should not be collected directly from the catheter and not from the collection bag. The catheter should not touch the container. Transport, immediate transport to the laboratory. It is if it is not possible, the specimen is to be refrigerated at 4 degrees centigrade. Laboratory method: the urine is centrifuged and deposit is examined under the microscope for detected pus cells, erythrocytes, epithelial cells, and bacteria. Cultures: most laboratory use a semi-quantitative method, a standard loop technique for culture of urine specimen. Standard loop technique: a standard calibration loop is used to culture a fixed volume of uncentrifuged urine. A third species of Klebsiella granulomatis have been included. This was previously known as a Calimatobacterium granulomatis. The blood agar and mechanical agar are used and incubated at 37 degrees centigrade for 20 hours. Next day, number of colonies grown is counted and a total count per ml is calculated. Interpretation of result: the significant bacteriuria bacterial count is more than 10 to the power of 5 per ml of single species. Doubtful significance: bacterial count is between 10 to the power of 4 to 10 to the power of 5 per ml. The specimen should be repeated for culture. No significant growth. 10 to the power of 3 bacteria per ml are recorded as a contaminant. Identification: the organisms are identified by colony characteristics, gram staining, motility, biochemical reactions, and slide agglutination test. Antibiotic sensitivity test: it is necessary to administer proper antibiotic. Diarrhea: the feces or rectal swab is plated directly on blood agar and mechanical medium. After overnight incubation, the growth on culture medium is identified by colony morphology, gram staining, motility, biochemical reactions, and slide agglutination. The identification of enterotoxin E. coli depends on the demonstration of labile toxin and stable toxin. The test for detection of toxins are shown in the table. The virocytotoxin producing E. coli can be detected in cytotoxic effect on viro and HeLa cells. The enterotoxin affects in rabbit ilia loop and its lethality in mouse. The enteroinvasive E. coli can be detected by Sereni test. Klebsiella. Klebsiella has been classified into two species, namely Klebsiella pneumonia and Klebsiella oxytoca. The third species, Klebsiella granulomatis, has been included. This was previously known as a Clamatobacterium granulomatis. Klebsiella pneumonia is further subdivided into three species. Klebsiella pneumonia, Klebsiella ozonae, Klebsiella rhinoscleromatis, and Klebsiella oxytoca. Morphology: they are short, plump, gram-negative, capsulated, non-motile bacilli. They are about 1 to 2 micrometer into 0.5 to 0.8 micrometer in size. Culture on mechanical agar: the colony appears large, mucoid, and pink to red in color. Mucoid nature of the colony is due to the production of large amount of slime by the organism. Biochemical reactions: gas and glucose, indole negative, lactose positive, mannitol positive, sucrose positive, urease positive, citrate positive, MR negative, VP positive, imbic, indole negative, methylate negative, vogus positive, and citrate positive. Antigenic structure: a capsular antigen. On the basis of capsular antigen, the Klebsiella have been classified into 80 serotypes. Somatic antigen: Klebsiella contains 5 different somatic or O antigen in various combinations. Method of typing: Klebsiella typing. Disease: Klebsiella pneumonia subspecies. Aerogen causes bronchopneumonia, urinary tract infection, nosocomial infection, wound infection, septicemia, meningitis. Klebsiella pneumonia subspecies Ozonae causes Ozonae. Klebsiella pneumonia subspecies rhinoscleromatis causes rhinoscleroma. Laboratory diagnosis: laboratory diagnosis is done by culturing appropriate specimen on blood agar and mechanical agar. The isolate is identified by colony morphology, gram staining test for motility and biochemical reaction. Proteus Morganella providencia. The tribe Proteae in the family Enterobacteriaceae contains 3 genera: Proteus, Morganella, Providencia. The single biochemical characters: phenyl pyruvic acid test PPA distinguishes this tribe from all other members of the Enterobacteriaceae. These bacteria are PPA test positive, that is, they contains an enzyme phenylalanine deaminase which converts phenylalanine to phenylpyruvic acid protease. These are motile gram negative bacilli characterized by swarming growth on agar. Two species, Proteus vulgaris and Proteus mirabilis, are included in the genus Proteus. Morphology: these are gram negative bacilli measuring 1 to 3 micrometer into 0.5 micrometer in size. They are non-capsulated, non-sporing, and actively motile culture. They are aerobic and facultative anaerobic. They grow on ordinary medium and culture. And emits a characteristic putrefactive fishy or seminal odor. When grow on nutrient agar or blood agar, the Proteus vulgaris and Proteus mirabilis exhibit swarming, but it does not occur with the Morganella and Providencia species. They form smooth, pale, all colorless, non-lactose ferment on mechanic agar and do not swarm on this medium. In liquid medium, peptone water, the Proteus produces uniform turbidity with a slight powdery deposit and an ammonical odor. Biochemical reaction: the biochemical reactions of different species of Proteus morganella and Providencia are shown. Are shown. Disease: the Proteus species are opportunistic pathogens and may cause many types of infections such as urinary tract infections, pyogenic deficiency infections of air, respiratory tract infection, and nosocomial infections. Impacted biochemical reactions of tribe Proteaceae: gas from glucose, Proteus vulgaris positive, mirabilis positive, morganella positive, Providencia alcalifaciens positive, Providencia stouti negative, and Providencia retrigi negative. Indole: Proteus vulgaris positive, Proteus mirabilis negative, Morganella morgani positive, Providencia alcalifaciens positive, Providencia stouti positive, and Providencia retrigi positive. PPA test: phenylpyruvic acid test. Proteus vulgaris positive, Proteus mirabilis positive, Morganella morgani positive, Providencia alcalifaciens positive, Providencia stouti positive, Providencia retrigi positive. Urease: Proteus vulgaris positive, Proteus mirabilis positive, Morganella morgani positive, Providencia alcalifaciens negative, Providencia stouti positive or negative, Providencia retrigi positive. H2S production: Proteus vulgaris positive, Proteus mirabilis positive, Morganella morgani negative, Providencia alcalifaciens negative, Providencia stouti negative, Providencia retrigi negative. Ornithine decarboxylase: Providencia vulgaris negative, Proteus mirabilis positive, Morganella morgani positive, Providencia alcalifaciens negative, Providencia stouti negative, Providencia retrigi negative. Fermentation of adonitol: Proteus vulgaris negative, Proteus mirabilis negative, Morganella morgani negative, Proteus alcalifaciens positive, Providencia stouti positive or negative, Proteus retrigi positive or negative. Fermentation of Trehalose: Providencia vulgaris positive or negative, Providencia mirabilis positive, Providencia morgani positive or negative, Providencia alcalifaciens negative, Providencia stouti positive, Providencia retrigi negative.